your body and your mind. None of us can function or maintain overall good health unless both mind and body are working together in balance. But while most people recognize the need for good physical health, experts say many neglect their mental and emotional well-being.
Mental and emotional health tends to be taken for granted by most people. We're very good at getting our cholesterol checked, our blood pressure checked, and things like that. But we sort of just assume that we're in good mental health for the most part, when in fact it would be an excellent idea, I think, to have mental health checkups.
Experts agree that one of the most common problems affecting our mental health is addictive behavior.
Addictive behavior is a very, very costly circumstance for our country. It's estimated that it costs $200 billion a year to deal with alcohol and drug problems. Most of that is lost productivity at work. But we know that close to 14% of Americans at some time in their life will have a dependency on alcohol, and probably about 7% a dependency on some other drugs.
Because multiple factors are often involved, addiction treatment can be extremely challenging. Mental health experts also say many patients eventually develop co-occurring disorders and multiple addictions. Specialists at this treatment center in Dallas, Texas, have set their focus on adult patients with co-occurring disorders or multiple addictive behaviors.
Part of the reason for looking at co-occurring disorders is that addiction is a brain disorder. All chemicals and process addictions change the way the brain works. And so in treating addiction, we're also treating the brain. Likewise, the impact of addictive disorders and also the processes that sometimes lead to addictive disorders are also mental illness, psychiatric disorders, so they occur at the same time, and hence the term co-occurring disorders. Sante's phases of treatment are relatively standard and are based on usual and customary treatment processes.
A variety of disorders are treated here, including drug and alcohol abuse, internet addictions to gambling or pornography, and eating disorders.
The first phase of treatment is mainly centered on understanding the external consequences and processes of addiction and learning the basics of recovery. The second phase of treatment is understanding what goes on internally, beginning to internalize those processes, understanding what it feels like to be triggered, what it feels like to be in recovery, developing a concept of spirituality and that connection with a much greater process. The third phase of treatment is focused on relapse prevention and taking recovery back into day-to-day life, learning how to structure, to organize, to be connected, and to deal with triggers and to have processes in place for when they do get triggered.
A multidisciplinary clinical staff, a comprehensive range of group, family, experiential, and individual therapies, and a peaceful residential setting are all used to help patients toward a full and successful recovery.
There is a lot of shame associated with this, and I just didn't want to believe myself that I had a problem. And once this was my jump start to be able to step out and say, I need to take care of Terry. If I'd had many years ago planned out my life and how good it could be, I could never have planned how great my life has been since Sante.
The combination of all these helpful sources can put a person onto the road of recovery. The question is, how do we get them started? That's the biggest hurdle. But once they get started, then I feel very optimistic about the outcome for the majority of people.
Eating right and getting plenty of exercise are certainly good ways to stay physically fit. But your emotional fitness is just as critical to your well-being. By recognizing the warning signs of behavioral disorders and creating effective treatments, mental health experts are helping countless people achieve emotional balance and a healthier life. A significant portion of the population struggles with untreated, painful, and often dangerous addictive disorders. Sante Center for Healing offers private comprehensive care for the treatment of dual diagnosis and multiple addictions in a tranquil, smoke-free 14-acre setting.
The Sante Treatment Center offers an important niche, I think, in the spectrum of addiction treatment. It provides residential long-term care if that's what is required. And it provides a nice integration of all we know about recovery from addiction, plus addressing psychiatric illnesses that may coexist with the addiction.
The phases of treatment are different for every patient. However, there are some common things. The first thing a patient has to do is acknowledge that there's a problem, and then what we call surrender or submit to treatment, so that by the time they're beginning to make discharge planning, they're putting in everyday structure, plans for recovery, plans for their medical care, basically wrapping around their entire life.
When I completed my inpatient treatment at Sante, I began an outpatient program for about 10 months to help me use the skills that Sante gave me, which was not only communication skills, but relationship skills, and skills that they gave me this giant toolbox of ways to relate in the real world and handle my problems. And so when I went out into the real world, it worked.
For more information, call Sante Center for Healing at 800-258-4250 or visit online at santecenter.com.